So here we're treating feet. This is quite another area that's quite often not treated. I generally do it with legs, although I do feet on their own. I do have a few clients that do have awful problems with their feet. So first of all, some nice effleurage strokes just to warm the feet up and get the lotion around. And then with feet, there's a lot more detail work. It's a lot less broad type strokes. So here you can see me working through the lumbricals on the top of the foot.
So important to sort of communicate with your client, especially they might have sort of ticklish feet, something that is often sort of a concern for both a therapist and the patient or client themselves. But by having a constant pressure, again, you're not sort of lifting off the pressure, smooth strokes. You can see Tamsin's hands never really leave the foot. There's always some form of contact, and that makes a huge, huge difference to treatment.
Just to say, with posture here, you can sit down to treat. I quite often treat feet seated, purely because it's easier on my body. So, and there's absolutely no reason why you can't. You don't need the power and pressure that you might through legs or back. So this is more about detailing it than power.
Yeah, so really good. So either lunging or squatting or sat down, as Tamsin says. You can see here some work through the individual toes. Now that can be almost a sort of form of rocking, sort of like moving each toe individually, a little bit of stretching as well. Really, really nice to actually have done.
Yeah, it is a really nice treatment to have done, and if people spend a lot of time on their feet, it can be really nice. I've got a few clients that have things like bunion issues and bits and pieces, and actually they get quite a lot of relief. So you can work through the arch of the foot, which I think is what I'm doing here,
Yeah.
And up onto the buniony bone as well, which is fine. It's all good.
Yeah, so anything that's sort of looking into sort of issues within the plantar fascia as well, so that's through the base of the foot. This is really, really useful. There's no good just treating the major soft tissues. You might as well go to the end of the chain as well. It will be much more thorough for you as a therapist, and therefore, again, the effects of your treatment are going to be so much better.
I will occasionally treat feet with my client to face down if I'm just having a quick run through them. I've also got a vulnerable client who finds it difficult to turn over, so we treat feet upside down or face down, should I say, as well.
But all things to consider as different type of massage.